So the fellowship program, it's essentially a 12-month program where you are surrounded by a lot of people and support as you transition into your role as a clinician or practitioner. Going from a bedside nurse to being a nurse practitioner is a huge leap, and it's a big change. The educators, the medical directors, the leaders, and even the preceptors, they've all kind of been in the same boat, and so you have them as your support system. 4 days out of the week, you are in clinic, you're seeing patients with a preceptor, and then 1 day a week is your didactic day. That's our in-seat learning day. With the didactic, you never know what you're going into when you come into these days. Sometimes it's what would you do, where they present patient cases, or we present patient cases, and then we go around the room to all of our other colleagues and they say, how would you treat this patient? Because in medicine, there's a lot of different ways to treat things. And it kind of just gives you perspective that not one way is always better than the other, and that we can all do different things to get to the same outcome for our patients. I don't think there's a bigger, better group of supportive people to have, especially during that first year and transition into practice.
One of the benefits of the program is you get the experience to be in with all the specialties in pediatrics, for example. So I was in pediatrics, primary care, but to be able to see cardiology, neurology, urology, all those different specific specialty locations, I was able to go to those locations, learn from their experience specifically. You're transitioning from being a nurse to a nurse practitioner, and you don't have that experience, but in those specialty rotations, you learn it. And they also know who you are through the fellowship. At the very end of your last 3 months of the fellowship, you're in a mentored program. And so you're kind of on your own, but you also have this mentor that's there to guide. My mentor started with me in the first 3 months, and then I ended up staying at that same office. And so throughout my 3 months of my mentorship, she was there for me and encouraging and pushing me. And then I ended up getting a job in that same office. So wonderful that mentor is still there and can still check on me every day. And so it's essential for sure.
I've looked at a lot of different fellowships, and not all fellowships have a strong didactic portion, and that's what kind of drew me more to this fellowship. When you work in an ICU, in the middle of those emergent situations isn't always the best time to debrief or talk about them, so the didactic portion allowed me and gave me the space to work through and reason through a lot of the things we do in the ICU and why we do it. One thing I loved about the fellowship was the camaraderie we had between our intensivists, between our residents, between our other co-fellows, APP fellows. And I remember my first weekend shift, I was pretty nervous going into it. And I remember receiving a text from almost our entire APP group asking, what can I do? Do you have any questions? If you need anything, give me a call. And I feel like that just spoke really well of our group, but also shows the support that you get in the APP fellowship. If you're considering doing a fellowship after graduation, I think it's a great opportunity to hone in on your skills and get that discipline and get that mentorship. I couldn't be more happy with my time in the fellowship.